Let me go ahead and hit record so we can be officially started now. So welcome everyone. I'm Joy Smith of FieldHaven, and I want to introduce Dr. Jen Yee, who is our medical director here at FieldHaven. She's been with FieldHaven since earlier this year, and we are so excited to have her on board because she is bringing to us a lot of interesting new things and really working with us and working with our staff to to have the very best care for all the cats in our care. And I just realized that I'm not showing you my face, but that's probably a good thing. But I'll turn it on right now so you can all see me too. So just a couple of housekeeping things. I am asking that everybody stay on mute so we don't have background noise. If you have questions, I would like you to hold your questions until the end. But during the presentation, please use the chat to put any questions in that you might have. And then I can ask Dr. Jen during, as we're going through, I can let her know that there are questions. But then at the end, we'll have a time where everybody can be off mute and ask questions. The other thing is that we're going to do something fun here. If you all look, let me see. I'm going to just do something really crazy, and I'm going to show you. I don't know if you can all see it, but I'm going to show you my shirt. And that's a little bit risque, huh? Sorry about that. My shirt says the Adventures of the Fungal Jungle, and it's don't fear the fungus. So this year we started, and with Dr. Jen's help and guidance, we started the Fungal Jungle at FieldHaven. And it is truly an interesting adventure because this seems to be the year of ringworm. Usually we might see, maybe 15, 20 cases max throughout the year. I don't know how many we've seen this year, but it has been a lot. And from what I'm hearing from other shelters and rescues, that seems to be the norm. A lot of people are experiencing an increased amount of ringworm. So it was definitely the right year for us to launch this program, but we didn't get a chance to ease ourselves into it. So we're going to do something fun. And the reason I was showing you my shirt was we're going to have cat trivia. We're going to have a couple of sessions of cat trivia as we go throughout the presentation. And you're going to use your chat to answer the question. And the first person that answers the question correctly will get one of these t-shirts, so a Fungal Jungle t-shirt. So let's start off right away with a cat trivia question. This is not really so much trivia, it's just a question. And I have to do a disclaimer here. If there are any FieldHaven staff on tonight, you cannot answer this question because you would probably know the answer. But just to give you an idea of where we are with, somebody said, McKenna said, darn it. So how many cat we have in the Fungal Jungle, and then throughout FieldHaven, on the main FieldHaven campus, how many cats and kittens do we currently have in the ringworm program in the Fungal Jungle? This is sort of a random guess. Like I said, probably only staff are going to do it, but feel free, and whoever answers the question correctly first, and I'll kind of give some hints because this is kind of a tricky question. And so Corey, go up. So I'm just going to give you guys some little hints as you start answering here. And Kim, wow, 43. I think we can go down.
This is Mariette. I would say 21.
21, Mariette says. Okay. Well, let's see. Mariette, it's in between Corey's latest of 15 and Mariette's 21. Oh, Corey, you're so close. You're so close. Okay, Corey wins it with 17. So we have 17 cats in the cats and kittens in the Fungal Jungle right now. It is actually, that is probably, Dr. Jen, that is like extreme maximum capacity, right?
Yes, exactly.
And
so Mariette's asking, that's right now we do?
Right this minute. right
Wow.
this very minute. So we do have some that are in foster, and then we do have some where I was today at an undisclosed location, or at a satellite location. Some of those cats also have ringworm too, but that's just here on the campus of FieldHaven. So with that, I'm going to let Dr. Jen commence with the real good stuff here. So Mariette, you will get a t-shirt. I'm sorry, Corey. Marianne, you'll have a chance to win a t-shirt later. We have a couple more.
Okay. Well, thank you, Joy, for that introduction. Congratulations, Corey, on that t-shirt. And just to give you just a teeny bit of background on me, I graduated from veterinary school 25 years ago. So I've been, in the field for a long time, and my special interest has always been, taking care of the cats. And so when the opportunity came up to work with FieldHaven, I couldn't pass it up. And I've loved every minute of it so far. And I hope that we can, it seems promising, this Fungal Jungle program that we started, because we kind of got thrown into it when I first started, and it seems to be working really well for the cats. And we currently have 12 kitties. Well, we had 3 test negative this week, which is excellent. So they can be set to go to surgery and then be adopted. But then we have 12 that have finished their treatment, and their tests are being run right now. So we should find out the results early next week. So fingers crossed on those guys. So anyway, I'm really excited to be here at FieldHaven and see what the future will bring for us. So on tonight's subject is ringworm, and how do we get rid of it? Why is it important for us to know all the background as far as like what it is and how do we treat it, and then how do we control it? And I wrote this PowerPoint. It was mainly for the animal care team and and everybody at FieldHaven. So, but we also felt that it was important for our volunteers to know as well, because you guys are there every day, just like the animal care team. So, so that's why we opened it up to all the volunteers as well, just so everybody can be on the same page. So this is what we're going to talk about, what it is, how we diagnose it, how do we treat it, how do we reduce the spread, what PPE means, it's personal protective equipment. We'll go into that a little bit more. And then how do we need to clean and decontaminate around it. And those are those 2 little kittens right there. Those are my foster failures, or 2 of them. I have others, but those are 2 of my kittens, but they're like 4 years old now. Okay, so what is ringworm? It's not a worm. It's actually a fungus, more like athlete's foot. And how we usually see it, and many of you have probably seen these lesions before on cats, but you usually get hair loss, which the medical term is alopecia. It can be red. You can get some circular lesions and scaling, and they can be itchy. Not all the time, but sometimes they can get really itchy for the cats. And so you can see on the lesions, the guy on the far left, he's got a lot of lesions all around his face. That picture right next to him on the right, has that typical red. You see the hair loss, but then you also see the red ring around it. That looks like it's right in front of the ear. The one next to that is, on his paw, and then on the face, and then, really good lesions on. And you usually notice all these cats that have the lesions are kittens. And there are different types of ringworm. The most common one that we see is called Microsporum canis. That's the most common one, and they get that from the environment. The picture up at the top, the blue one, that's actually what ringworm looks like stained under the microscope. So that's what they look at. When you see the culture plate, if you culture it out on a culture medium like that plate on the right, and you take some of those colonies and you put it under the microscope and stain it, that's what you're actually going to see. That's what Microsporum canis looks like. And it's transmitted by direct contact with an affected animal or contaminated item or environment. So that's what That's why cleaning and disinfecting is so important, because that's how other animals or people can actually get it. It can be also spread through spores in the air that can land and contaminate on hard surfaces. So it can, go through the air and then land on things, and then that can be a source of that infected spore for someone to pick up. And like I mentioned, it is a zoonotic disease. Zoonotic meaning that humans can contract ringworm from an infected animal. That's a disease that an animal can pass to people. So when our skin is directly exposed to them, we can catch it as well. So that's going to be part of, why it's so important to wear the PPE, is to protect us from contracting it, and then also from spreading it. So how do we diagnose it? So for us at the shelter, it's going to be at intake. When we take in these animals, we always do a physical exam. So for all new intakes, especially kittens, we're going to look really closely for any kind of skin lesions. And those skin lesions that we talked about before were, the hair loss, the circular red area, the crest, and things like that. And they're going to be on the face, the inner and the outer ears, limbs, and paws most of the time. It can be on the body as well, but we're going to want to look at the face and all the extremities first. And if we see any lesions, then we're going to do a Woods lamp examination. So it's like a black light exam. And so those are different, up at the pictures up at the top are examples of different types of Woods lamps that we could use. And once you notice the lesions, wearing gloves would be a good thing at that point, because if we're suspicious that it does have ringworm, that is the time that we want to start, protecting ourselves. So go ahead and put on a pair of gloves, and then we're going to examine the entire animal with that light. And we're going to focus on the ears, both front and back, the muzzle, around the eyes, all around the face, and the little whisker pads, and then all 4 feet and limbs. So what does it look like under the light? So the ringworm, the fungus, infects the inside of the hair. So that means that some of the ringworm will glow with the black light. And so you're going to see the hairs. It's not the skin that's going to glow, it's the hairs and the hair shaft. So the hair shaft, as it's growing out of the follicle in the skin, that's what we're going to see. And you're going to see like an apple green. It's not yellow or any other color. It's specifically like a fluorescent apple green color. And if you can see closely on the pictures, it's actually the hairs and not like spots on the skin. And what can be confusing is that the crest that sometimes we can get with some of these lesions can also glow, but they're going to be yellow or they're going to be blue. They're not going to be this apple green color. It's also important to note that only about 50% of the Microsporum canis of the ringworm will actually glow with the light, with the black light. So if we're suspicious that this cat does have, this cat does have the characteristic lesions, but there's no black light, or it's negative on black light, we're going to want to take some hair samples and submit it for testing, just to make sure if we have a positive or not. So we'll talk about that when we get to the diagnosis part or the testing part. And so here's a video. I think it'll play on how to do the Woods lamp examination. So let me see if we can play that. Oh, there it goes.
That poor kitten's getting the real exam there.
There should be some audio, shouldn't there?
No, there's no audio to it.
So she brought up some really good points about the glowing most of the time the ringworm's going to be that apple green glow. Sometimes a smaller percentage will have that blue or white glow, but again, it's going to be on the hairs. You're going to see the hairs kind of fluoresce. And so when you start looking at them a little bit more, you'll be able to tell, the difference between what's real glowing and what's that fake glowing, like she was talking about. So like the crust, sometimes medication, dust can show up like the green, like the yellow color or a green or the blue color or white color. So what we're looking for is on the hairs, and a lot of times it's going to be close to the skin that it's going to happen. So, so if there's any question about that, have one of the medical team, Roxy or me, take a look at it, and then we can kind of be a second pair of eyes to look at that. I think this would be a good time to break, and if there's any questions or if you want to do another t-shirt.
Sure. I've got a really good question from Corey, and then we can do another another video trivia question. Corey asked, can the spores infect someone through inhaling the spores, or is it just through contact of the spores on the skin?
Well, that's a great question.
It is.
So yeah, it's mainly on the skin. It's going to be skin to skin. So you don't really inhale it. It's something that I don't think it can survive in the body. It's made to infect the skin. So
well, that's a relief then.
Yeah.
Okay, so trivia. Okay, this is for everybody, so staff can join in too. Besides their face, we all know kitties have whiskers on their face. Where else do they have whiskers on their body? Remember, put the answer in the chat, and well, the ears are the face. They're part of the face and head. But good guess, Kim. I'm looking for someplace else. On their butt. No, that's not it. All right, come on. We need some people to guess here. Kim's trying, all right? You're all looking at your cats right now.
Yeah.
You're so close, Brenda. You're so close. And Kim is close. It's very close. No. Go up a little bit. The toe beans, yeah. Okay, I'm going to accept the ankle from Kim Brady. And sorry, Janet, you were on there with legs. So you're right behind her. Okay, you get a second place. So yes, they have whiskers. Now you're all going to go look at your cats, and they do have whiskers on the back of their legs. And what they're used for is, well, several things. One of them is for hunting. So when they grasp their prey, they can feel if the prey is still moving with those whiskers. Another reason that they use them is they use them for climbing. So they're for climbing trees, and it helps to give them traction somehow. And they are called carpal whiskers. So there's something you all learned today. And now go look at your kitties and check out those carpal whiskers and never trim them, okay? Because they might want to get their prey. So, okay. So, Kim, I'm putting you down for a t-shirt. And one more quick question before it scrolls off my screen here. Tony is asking, is there always hair loss?
If there is, no, that's actually a really good question. So cats, if they come down with the infection, yes, there is always hair loss. There's usually some kind of hair loss there. So, but they can carry the ringworm and not be infected. So it also kind of depends on, their genetics, their immune system, as far as like if they're going to get infected with it, if they come in contact with the ringworm spores. So that's why kittens are you see ringworm infections most commonly in kittens, because they're younger, their immune systems are not mature yet. So, so that's why we usually see it in kittens, but adults can actually carry it and not show any signs. So yeah, so the answer to your question is, there's not always hair loss if they're a carrier. So they can have it on their skin. They can have it on their fur, but not be infected, if that makes sense.
Excellent. That's all the questions I have now. So
Yeah. Okay. Okay. So other ways that we can diagnose ringworm are other kind of tests. So there's what we use at the shelter are ringworm. It's called a ringworm real PCR assay, or we'll call it the ringworm PCR. And this is where we'll take hair samples and we'll submit it to the lab. And so we'll take a toothbrush and we'll kind of brush the coat until we get hairs on the bristles. We want to do it at least 30 times, and we usually do it a lot more than that. And you're going to want to do it, on the face and the ears and all those, suspected areas. And then if they do have lesions, then you're going to want to comb on those lesions, or we can even pluck the hairs and put those, in our sample as well. And then we put it in a brand new little plastic, bag, and then we submit that to the lab. And what they actually do is they test for the PCR test for DNA. So it's actually looking for the DNA in the ringworm that's there. So if it's positive, we know that there's ringworm there. So that's one of the tests that we use to confirm if they actually have it. But we also use it to monitor, treatment to see if that's worked or not and see if they've recovered. So when we do our intake, we always examine kittens really carefully for lesions, and then we use the Woods lamp also to look for any fluorescence. So if we do see lesions and it's blacklight positive, like it's fluoresced that apple green color, then we're going to put them right away into the fungal jungle, and we're going to start them on the ringworm protocol, which we'll talk about next. But if there are no lesions, but we do see some fluorescence on the black light, so maybe this one might be a carrier, then we're going to isolate that one in the fungal jungle and then start that one on ringworm protocol. So anytime you see any kind of fluorescence, especially when you see that apple green on the hairs, regardless if we see lesions or not, we're going to count that as positive, and then we're going to start treatment for ringworm. If we do see lesions, but we get a negative on the black light, we are going to put them in isolation or quarantine. If we do have room in the ringworm jungle, we can put them out there. And then we're going to collect samples for the ringworm PCR. Because if it does come back positive, that confirms that the lesions are truly ringworm lesions. And then we're going to start them on the ringworm protocol. And then we're gonna also try to find out if they've had any ringworm exposure, because that might help us decide if this really is ringworm or not. We can have it scheduled for a doctor to take a look at it, and there's other testing that can be done. We can do like a skin scraping looking for mites, because sometimes skin mites can have similar looking lesions with the hair loss and the crust and the redness. We might want to consider treating for fleas, because as everybody knows, fleas can cause hair loss as well. And so we might start looking for other things, especially if the PCR comes back negative, other causes of the hair loss. So if the PCR is negative, we can repeat the black light, and then if it remains negative, then we can release the patient from isolation, and they can be available for adoption. But if the PCR is positive, then we're going to start them on the ringworm protocol and isolate them in the fungal jungle. And something that we're trying to be better about is we're documenting the lesions and then where they are located on the cat. So that way, when we're rechecking them later, when we're re-examining them, like with the black light and things, then we know exactly where we're looking, and we can see if the lesions have improved or not. And then also, it's important to note that any cats and or kittens that are diagnosed with ringworm or are suspicious of having ringworm should not be placed with fosters who have young children or have immunocompromised adults. Just because, you know, those individuals can have a compromised immune system and they are more susceptible to coming down with a ringworm infection. So we don't want to, you know, put that burden, you know, on somebody who potentially can come down with an infection. Even healthy adults can come down with the infection. Not everybody does, as long as we're careful with our decontamination and our personal protection equipment. That's the goal of that, so that we don't catch anything. But, you know, if we have any fosters that might be at risk, then they might not be we might want to find other options for those kittens. And so we're gonna also, if the fosters agree to take on housing these cats and treating them, then we're gonna go over the treatment and proper decontamination procedures with them. We'll fill out a treatment schedule for them to follow for each cat and kitten. And then I created a ringworm for foster home handouts for them to, that goes over all the cleaning and decontamination practices that will help them keep the ringworm isolated and contained in their home. Okay, so treatment, as some of you have probably seen, is, you know, there's two things that we do for treatment. Well, really three things. So two things. The first one would be the intrafungal liquid, and that's the medication, the antifungal medication that they would get for a total of 5 weeks. So we would give it to them 7 days in a row, and then they're off for 7 days, and then we'll treat them for 7 days, and then off for 7 days, and then treat for a final 7 days. And that's a total of 5 weeks. So the treatment, the whole treatment for ringworm typically takes at least 5 weeks, sometimes more. And the goal is, most cats should be clearing after 1 round of treatment. You know, occasionally you might have one that might need a second round, but hopefully that our goal is for all cats to be cleared with 1 round of treatment. And this medication is actually fine. It's okay for kittens as little as 1 pound. And so because we're mostly dealing with kittens and they tend to grow pretty quickly, you know, each week that we have, we start off on the medicine week, we should be reweighing them and recalculating their medicine dose to make sure they're getting an accurate dose for their weight. And so our animal care team is really good about doing that. So that way we can make sure that they have their proper dosing each week. So the second thing that we're going to use to treat them is we have a topical treatment, and this is the lime sulfur treatment. And it's exactly what it smells. How it sounds like is exactly how it smells, lime sulfur. So it smells like rotten eggs, and it really does. And so, so this is something that we do twice a week for them during the treatment, along with the intrafungal. And this one we can even do for kittens that are under 1 pound. So those that are like so tiny that have lesions, those really little kittens that we can't quite start the oral medication on, we can at least start them on this topical treatment. And we're gonna dilute it 8 ounces per gallon of water. And this is actually twice the concentration that's listed on the bottle. So that's important to note if you're helping the animal care team, you know, with the dipping, you know, we want to use the 8 ounces per gallon dilution. And that's also going to be called, you'll see it, you know, in other places called the 1:16 dilution. And you're definitely going to want to wear gloves, not only because, you know, you don't want to catch the ringworm, but you also don't want that lime sulfur on your hands, because it takes a while for that smell to come out, and then your skin is yellow. Ask me how I know that. So
and
we're
if you
going to do
have
this.
gold jewelry, it will discolor it too. I've seen that happen.
Oh, that's good to note too. Yeah.
I've seen that happen too. I'm like, ah!
Okay, yeah, that's a good point. That's a good point too. So, so yeah, we're gonna do this twice a week. So right now our animal care team is doing it on Sundays and Thursdays. so twice a week. And what a lot of the ASPCAs and larger humane societies are using now is a garden sprayer. It's a fine mist spray that we can use to wet down the kittens, rather than having dunking the kittens actually dunking the kittens in a bucket of the solution, which can be kind of stressful, because a lot of cats don't like, it could be stressful, going, about all that water being dunked in the water like that. So a lot of cats don't like that. And so we find that we have them on a table, with a towel, and, use the sprayer, a fine mist, underneath their neck, and, just thoroughly wet down to the level of the skin. It's a lot more, it's not as stressful for them. So we've tried that and have been successful with that. And the staff seems to really like that, that protocol. And then when we need to get around the face, nose, and ears, because that's where a lot of the ringworm is, we're going to use, we have small makeup sponges that we use to apply that around the face, so that way it doesn't get into the eyes. But if it does get in the eyes, we just rinse it out with some eye wash, and then that should be fine. And then we don't want to really towel them off. You want the lime sulfur on their skin and on their fur. So we will kind of squeeze or kind of hug dry with the towel and let them dry. We don't want to rinse it off. And so that's how we do the lime sulfur dip. And then I did find here's another video. This one's from the San Francisco SPCA on how to dip the cats, and they utilize that garden sprayer. So we can watch this one. This one's shorter. Are you guys seeing the video? It's just spinning, huh?
Yeah, it's funny because it's going through, but it's not. That's
yeah,
kind of
you
weird.
hear
It's
the
like,
music, but it's not loading, is it?
yeah, that's really weird.
Okay. That is really weird. Here, let me go back and
yeah, try it again.
let's try it one more time. Oh, there we go. Okay.
Marriott says she doesn't know how to see it. She's not seeing it.
I'm seeing it. So it could be, what we can do is we will put the link to this video in when I load up the recording for viewing, I will put the link to this video on the recording.
Okay, here we go.
We actually have lots of questions right now, Dr. Jen, if we want to do a few questions.
Okay. Sure.
And one thing I just wanted to talk about real quickly, what they were saying in that video is that being taught, happy talk and trying to make it stress-free on the cats. And I can tell you a huge difference that we've all seen since we implemented the fungal jungle, and Dr. Yee, you have put in, you have come up with helped us with the protocols, and the staff are applying these protocols, I see a huge difference in the cats and kittens after treatment of how social they are. They come out of treatment ready to go to adoption, just absolutely lovely. So the staff is doing a really great job of, I mean, how do you make it fun? But but of really
Right,
giving
yeah,
those cats
yeah.
good, positive energy and spending time with them. And the volunteers are too. We have volunteers that are out there, and that's really important for the cat's mental well-being. So I just wanted to point that out, that I have seen a huge difference in that with the cats as they come ready for adoption. So thank you, the
Yeah,
staff and the
yeah.
volunteers. Okay, so
That's great to hear. Yeah.
couple questions. Tony asked, how long does a PCR test take? And Roxy did answer that, about 3 to 5 days. And she asked about how accurate is it? Is it more like, is there false positives or negatives?
There can be some false positives because, like I said, it tests for the DNA. It doesn't know if it's a live spore or if it's a dead spore. So if there are any dead spores that are on them, it can be a false positive, at the end. But we usually submit these as a group. There's usually multiple cats that we submit. So I kind of use that as a gauge as far as, like, if somebody comes back positive, but then the 2 others in that same cage are also positive. So that makes me think that it's less likely that it's going to be a false positive. And I think that's truly positive. You know what I mean?
Yeah.
So, but if it was just 1 out of the 3 that was positive, then I might say, okay, maybe that one might be a false positive. Because I think the PCR is the best test for us right now. There are some places that are using, they actually do their own fungal cultures. Like, they'll take the hair and put it on the plate and grow it there. I think that's something that we can consider at a later time, because I think right now our focus is to make sure that our cleaning practices and our decontamination practices are solid first before we move on to another big, project thing to add. So I think the PCR has been doing well for us right now. So I think that's what we're sticking with right now.
And then next question from Tony is, does itrofungal prevent reinfection?
That's a good question too. No, it doesn't. I don't think there's any residual activity in it. So if they came up positive again, like after they went through the whole course and then it came up positive, then if I determine that, this cat, probably does still have infection, then we're going to want to do another round of the treatment. So I don't think there's any residual there. I mean, if there is, it might be just like, a few days, but you're going to want to continue with it.
Next question is, what's another good one? Why does the treatment regimen have an on-off protocol?
That is a good question. So the intrafungal, the ingredient is the itraconazole, antifungal. It can affect the kidneys if given for a long period of time. And, unfortunately for the ringworm spores, it takes a long time to kill it because it's really hardy in the environment. That's probably something I don't know if I said that or not. It's really hardy in the environment, can live in the environment for a long time. Not a lot of things can kill it. For a long time, we just had bleach solution. That was the only thing that would kill it. And so, but now we have rescue and, some other things that can kill it. But rescue is the most benign thing that we have right now. When we used to use the bleach solution, it's really caustic when you breathe it in. It can cause, it's caustic to the skin if it gets on your skin. And, it's just not pleasant for the hospital or, the room that you're, the shelter that you're in. So, so using the rescue is good just because it's so hardy. So it needs to be done for a long period of time. And so, so doing that, we don't want to run the risk of harming their kidneys. And so that's why we kind of do this pulse therapy where we do like, 1 week on and then 1 week off and then 1 week on. If you have an adult, a healthy adult who has ringworm, then that's one that we might be able to do 3 weeks in a row because they're healthy and their kidneys are, are working fine and can handle it for 3 weeks in a row. So that would be the only time when we would want to shorten it if they're a healthy adult, especially if we did blood work and their kidneys were healthy. Then yeah, let's do it in three weeks, get the ringworm treated and get them, get them out and adopted sooner. But for these little guys, it's best to kind of pulse it so that way it doesn't harm their kidneys as much. That was a great question.
Yeah, it was. Okay, I think that's it for. Do we want? Let's do another trivia. I got an easy one for you guys. Okay, so everybody get to your keyboards because you're going to want to type fast. What famous amusement park has a feral cat colony to keep rodents in check? Corey.
I know this.
No, wait, who got it first? Oh, Kim got it first. Wait a minute. Wait, we're going to have to go down here because Kim got it first. Then Corey. You guys have already got a t-shirt. So Brenda got it next. So Brenda, you're the winner. And Kim said, I already won. I just wanted to be first. And Corey said, oh, wait a minute. Wait. Okay, we got a confusion here. Diane is with me. All right. So you know what? We're going to give Brenda and Diane each a t-shirt. Okay. You know what? We can never have too many of these these fungal jungle t-shirts out there. So we'll do that. Okay. But yeah, everyone knows about Disneyland's feral cats.
I always look for them whenever I go. I never see a cat.
Never see them?
I've never seen them, but I always look.
I think you have to have a special tour or something. I know somebody, next time you go, let me know. I know someone who works for Disney and it's called, she runs a nonprofit down there called Cats in the Studios. So she has connections.
Oh, okay.
Yeah, so let me know and I'll get you connected with her and
awesome.
She can get you a tour of the cats.
Yeah, I know because every time I go, ever since I found out about them, I always look because I'm always looking for all the cats. But I've never seen one there. I figured they're all probably backstage until everybody leaves and then they come out.
Yeah. Okay, so who do we have? Who won that? Brenda and Diane? Did I say that right? I don't know. Yeah, I think so.
Yeah, Brenda and Diane.
All right. Okay, so let's carry on.
Okay. So while we're treating, it's ideal if we kind of examine them every week just to kind of see if the lesions are improving. Are we starting to see hair grow back? Or do we have new lesions? Sometimes, especially right after we start treatment, sometimes we start to see new lesions before the medicine starts working and starts killing the fungus. So it's good to kind of, examine them regularly and then also black light and see if we see any of the fluorescence. Hopefully we, as time goes on during the course of treatment, hopefully you'll see less and less to almost none, no fluorescence, towards the end. And then once they're done with the treatment, we're going to verify the cure. So we're going to submit, that's when we submit the hair sample. So everybody who finishes the treatment, we're going to submit hair samples for that ringworm PCR. And as long as those tests are negative, the PCR has to be negative. And then when we do the black light or the Woods lamp test, that has to be negative as well, no fluorescence. And then if all the skin lesions have resolved, meaning that we're now starting to see hair grow back, then they're going to be considered cured. So they need those 3 things in order to be considered cured. And so once they're cured, then we're going to do one last final lime sulfur treatment, and then they can be moved out of the jungle and graduated and get their certificate. And that's the whole goal of all of this. Okay. And so reducing the spread, why is it so critical? Why is it so crucial? It's important we don't spread ringworm to our healthy animals because resources are needed for the care of ringworm, lower our capacity to save more lives. As you can see, we treat one cat needs at least 5 weeks, 5 or 6 weeks to be treated. And if they get reinfected, if we're not doing a good job preventing spread, and they get reinfected, they're going to be treated for additional 5 or 6 weeks. So that's going to be, like 12 weeks, possibly. And that's like 3 months when it could have been like a month and a half. So it takes up a lot of resources and a lot of cage space. So as long as if we can control it to just one treatment and get them out of here, then that's better for them, because the less time that they spend at the shelter, the healthier they'll be, the less stressful they'll be, and then the happier that they'll be. And then the ringworm symptoms can be benign, but they can be uncomfortable for some cats. Some cats can get itchy, with the crustiness and things like that. So it can get uncomfortable. So what's our job? How do we prevent the spread? So we're going to isolate all the positive animals in the fungal jungle, where everything, the animals, the cages, all the supplies in there is considered contaminated. And so contaminated items are either going to be thrown away, they're going to be disinfected with the 1 to 16 dilution rescue, or they're going to be laundered with bleach, like the laundry. And when we enter and exit the fungal jungle, we're going to do it properly with the right PPE, the personal protection equipment that we'll go over next. That's going to reduce risk of tracking ringworm outside of the fungal jungle on your skin, hair, clothes, and shoes, because we certainly don't want to be passing any of our ringworm to any of the cats that we have on the property. Or you don't want to take it home to any of your kitties at home. So when we enter the fungal jungle, we want to make sure all your PPE is on before you enter. So ideally, we have booties on the outside now. So put on the booties first, and then go straight into the inside and put on the rest of your equipment. So that would be your gloves, the gown, and if you need a hair bonnet to protect your hair, if you have long hair, that needs to be up or in a hair bonnet. And then when you're exiting the room, we have to be careful that we're not stepping outside with our contaminated booties. So when you're still in the fungal jungle, you can take off your bonnet and your gown, leave your gloves on. You're going to open the door carefully, maybe with your elbow, stand in the doorway, take off one booty at a time, put it in the trash that's right by the door. Your clean shoe will go on the outside of the fungal jungle. Take off the second booty and put that in the trash. And now that clean shoe can go outside. And then you take off your gloves and put them in the trash. So it's a little bit of some coordination, but that's the proper way to make sure that we're not going to track any of the contaminated stuff outside of the fungal jungle. And if you need somebody, if you're more of like a visual person, we can either see about like making a video maybe, or one of our animal care team can walk you through that. So this is what I mean when we talk about PPE. This is your personal protective equipment. So we're protecting our cats as well as ourselves. And this is where we have long sleeve gowns. So we're gonna get, the blue ones that we have are good. They're waterproof, but they're not really breathable, especially when it's hot outside. So we're looking into getting the yellow ones, which are lighter, more like a mesh that's still gonna be protective, and they're water resistant, but they're a lot cooler. They allow a little bit more breathing room. They're not as hot as those blue ones can get, but use them if that's all we have. And then gloves, of course, and make sure your gloves are over your sleeve so no skin is showing on your wrist. And then the shoe covers. And then for your hair, if you have long hair, have it tied back or up in a bun, or you can use a hair bonnet. We should get some of those if we don't have any. And then optional would be a face mask. And then I consider cleaning and decontamination the third part of treatment, because you could do everything else as far as treating with the intrafungal and the lime dips, you know, perfect to the T. But if we don't do proper cleaning of their environment and they get reinfected with spores, then that was all for nothing. So I really consider cleaning to be like the third treatment for ringworm, because it's so important in this case. So again, you know, we're just reiterating the rescue solution has to be diluted, you know, 1 to 16 ounces per gallon. So on a daily basis, we could do spot cleaning. You know, any area, if you see hair, you know, you can clean that up, and you can clean the organic matter as far as like dust, dirt, food, hair, using Dawn and water, or even the diluted rescue spray, and then change litter if needed and refill waters, and, you know, and all that stuff that we do on a daily basis to take care of the cats. The more intensive cleaning is going to happen on the deep cleaning days. And so ideally, if we could do this twice a week, that's great. At least once a week. And my recommendation was to do this on our lime dip days. And so right now they're doing it on Sundays. So that way, when they dip the cats, they will put them in their carriers to dry, and then they can deep clean all the cages and everything. So that's where we'll remove the bowl, all the bowls, all the bedding, toys from the cages. We do have designated laundry bags for beddings and toys. And once those bags are full, it's ideal to spray them with the rescue on the outside, so it's disinfected on the outside. You can spray the outside. Yeah, or just say that in the next line. And then we keep the laundry bags in the fungal jungle until they're ready to be laundered. And then when the washer is ready, then we just take it right in there and just dump it right into the washer, and you can wash the bag in there as well with the bleach solution. Clean all organic matter with Dawn and water or the diluted rescue spray. And then we're gonna disinfect. So you do the cleaning first, and then we disinfect. And that's where we're gonna spray the rescue on it and then allow it to sit for 10 minutes. And that's gonna allow it time to kill the ringworm spores. If we need to, you can set a timer. And then you can wipe it down. And then as long as, you know, so when you're disinfecting the cages, so it's all surfaces of the cage, so it's 4 sides, the back, and then also the door as well. So we want to make sure we spray the inside of the door, because hair can get trapped in there as well. And then wipe it down after 10 minutes. And then once it's all clean, we can set up new bedding, food, water bowls, litter box, etc. And then we wipe down any countertops. You know, clean the cages. Vacuum the floor. There's a shop vac in there now. You can vacuum the floors, all the hairs. Make sure we get the corners and underneath the cages as well. And then disinfect the floors. Everything needs to be cleaned. Everything in there needs to be cleaned. And this is just kind of going into more detail about how to clean like hard surfaces and the soft surfaces. Like soft surfaces, like the stuff in the dryer. We need to be cleaning the lint filter after every use. Don't overfill the washing machine to make sure that everything gets cleaned thoroughly. Toys have to be cleanable or washable. So nothing fibrous. So no scratching posts or any kind of fibrous toys. It has to be plastic or something that can be cleanable. And we don't want to, and I think everybody knows this, but we don't want to mix dirty ringworm laundry with other laundry. We don't want to risk anything else getting contaminated. And then I just kind of made some, you know, workflow ideas. I think the plan is to make more, to make some signage to put out there and some checklists to make sure that everything gets done, you know, when we're out there, now that we have more people working out there. So, so I think that's on the to-do list to do. But for now, it'll be for like daily cleaning. You know, you put on your PPE as we talked about, spot clean the cages and do the food, water, litter bowls, litter boxes, administer medications if it's treatment week. And we also want to make sure, this is also important, change gloves in between cages. It's fine if we have like two kittens per cage, 2 or 3 kittens per cage. That's fine. You can use the same pair of gloves for that. But what we need to do is change gloves. So an idea would be that you have your base PPE on, you have your gloves and your gown. You can put a second pair of gloves over that, and then that's what you change in between cages. So that's just kind of like extra protection, you know, type of thing. So you clean one cage, then you change gloves, clean another cage, you know, change, and then change gloves, etc. And then just more, just kind of like a workflow, how things would go when you're in, when you're doing the deep cleaning day, like on Sundays, or if they decide to do it on Thursdays as well. Another thing that I'll also mention is that, you know, before you go into Fungal Jungle, before you put on your booties, it'd be a good idea to think about, what are you going to do in there? Do you have enough supplies? Do you need any supplies? You should get those before you go in. So that'll negate the need to, you know, leave and then come back and then leave and then come back, because you're going to have to take off your PPE when you leave and then put it back on. You put on new stuff when you go back in. So, you know, you want to be prepared when you go in there and have all your supplies all ready to go and bring in with you when you go in. And just want to say thank you to all you volunteers and all our, you know, medical team. You know, I think it's been really great being part of you so far, and I just look forward to what we're going to do. And I think the Fungal Jungle is just the first of many things that we're going to do together. So thank you to everybody for being so welcoming to me and to my ideas. And here's to the future.
Yay, here's to it, right?
Yeah.
Thank you, Dr. Jen, and thank you for being with us too, because you really are a treasure to us. And to the kitties, of course. So we've got a few questions.
Yeah.
Everybody's come up with some really great questions here. I actually have one myself. So when you're saying that we can't have any porous things in the fungal jungle, for enrichment, can we use cardboard scratchers or pieces of cardboard for them to be able to scratch out?
You know, yeah, I mean, the cardboard, I think that would be fine. And then we would just have to, you know,
Just
throw it away once
dispose of
and bring them new one. Yeah.
Okay.
Yeah.
Okay.
Yeah. Cardboard, I think would be fine, because that can be thrown away.
Okay.
And then
that's
just
what
get,
okay.
you know, to give them a new one in a week. Yeah.
Okay.
Because we're gonna
Well,
want to rotate them out. We don't want them to have the same one for the full 5 weeks, because, you know, hair is gonna get stuck in it.
Gonna get stuck in there.
So
So that's something we could put on our wish list for the Fungal Jungle for people to donate. So maybe those they have the tiny scratchers that people could donate,
like
so
Dollar
we could
Tree,
rotate.
I think Dollar Tree has those little, like, dollar or $1.25 store. Has those little cardboard scratchers now.
Oh, good idea.
So that would work, because we could just throw those away or recycle them, or
Yeah, that's
probably
great.
throw them
Kim
away.
said yes, they do. Okay, so some other questions that people had: is non-chlorine bleach good for disinfecting laundry?
No, it has to be bleach.
That's what I thought. Okay, I thought that too. And let's see, Corey's question was answered. Shirley has a good question. This might be a video. How to recommend a way to remove the gloves. So you're not like getting, when you remove the gloves, you're not getting it on your hand. So I think it's as a surgeon, a doctor, you probably do this
because if you have, if I have gloves on both hands, I could probably go get some. I have some somewhere. But if you have them on both your hands, what I usually, because your hands are going to be dirty, so I take, at the wrist, I grab on the wrist part of the glove, and then I peel it off that way.
Okay.
if you can make sense. So
Right.
it goes up to like about here on your wrist, right?
Right.
And then so I'll take it right near the end, because you don't want to I don't want to touch, I don't want to try to touch my skin. So I
Right.
take, right under the rim or that ring that's there, and then so I pinch that, and then I pull it off that way.
Oh, okay. All right.
And
That's kind of like I
you
think what
have
I do too.
yeah, and then you have your clean hand. That one can, I would, you could do that, right underneath, but right on the rim of it, then just peel it off. Peel it off
Okay.
that way, yeah.
Let's see if there's any. No, I think that's it. Those are all the questions. You guys had great questions.
Yes, so you guys did have some good questions today.
Okay. Are there any last minute questions, or you can unmute yourself if you want to? You're allowed to talk now. If anybody has any, but otherwise, and you know what? We landed right at just a tiny bit over an hour, so we did good. All right, then thank you everybody, and Corey,
Joy?
Kim, Brenda, and Diane will be getting with you on t-shirt sizes. Somebody just said they had I think a questions. I heard my name.
Joy, I just wanted to say I'm sorry for being so late. I had a hard time getting on.
Okay. Well, for what you missed, Shirley, we're going to post this to the recording. So
Okay.
so you'll be able to catch what you missed.
And it looks like there was somebody else just came on because they thought it was at 7 o'clock. So Maria.
No, Maria, I'm so sorry. Well, but Maria, you'll get to watch the recording because we're going to post the recording. So no worries, but you got to at least say hi to all of us. Okay, well then great. Everyone have a fabulous weekend, and carry on, and let's conquer the ringworm. All right,
no more
everyone,
fungus.
take care.